Documentation is anything written or printed on, which individuals rely on as a record of proof of patient action or activities. Documentation constitutes a fundamental part of nursing care, and the information communicated by nurses regarding their patients' care reflects the quality of care and the accountability for the care they provide. The medical record is a legal document that requires information describing the care that is delivered to a patient. Current documentation standards require that each patient have an assessment based on their physiological, psychological, environmental, self-care, patient knowledge level and education, and discharge planning needs. Nursing documentation standards are set by federal and state regulations, state statutes, standards of care, and accreditation agencies to help maintain institutional accreditation and minimize liability. Other standards of care, such as the Health Insurance Portability and Accountability Act, include those directed by state and federal regulatory agencies and are enforced through the Department of Justice and the Centers for Medicare and Medicaid Services. The Joint Commission standards require that nursing documentation be within the context of the nursing process, including evidence of the patient and family teaching and discharge planning. Nurses are legally and ethically obligated to keep all patient information confidential. Nurses are responsible for protecting records from all unauthorized readers. HIPAA requires that disclosure or requests regarding health information be limited to the minimum necessary. Nurses may not discuss the patient's examination, observation, diagnosis, or treatment with other patients or staff not involved in the patient's care. All information pertaining to the healthcare management and gathering by examination, observation, conservation, or treatment is confidential. Students must be very cognizant of how they collect and track patient data. They must not have any patient identifiers on their paperwork, including the patient's birth date, social security number, room number, or medical record number. Nurses should be cognizant of how they handle and dispose of protected health information, including information that is printed, faxed, written on report sheets, stored in computer files, and files that are emailed. The purpose of patient records are for legal documentation, communication of patient events, reimbursement for the hospital, education for nurses and patients, research, and auditing and monitoring of patient events. Reimbursement is based on diagnostic-related groups. Diagnostic-related groups, or DRGs, are the basis for establishing reimbursement for patient care. They're a classification based on the patient's medical diagnosis, and hospitals are reimbursed a predetermined dollar amount determined by the Medicare for each DRG. Guidelines for quality documentation and reporting for nurses include nurses to document factual events that are objective. They're documented accurately, completely, currently, and in an organized way. Most hospitals document using military time. Guidelines for legal recording include that nurses should begin each entry with date and time and signature. Nurses should write legibly in black ink. Nurses should not leave blank spaces on nurses' notes and should correct all errors promptly using the correct methods. If an order was questioned, nurses should record and write that clarification was sought. Nurses should only chart for themselves and not for others. Nurses should avoid generalizations when charting on patients' records, and nurses should make sure to keep their computer passwords secure. When documenting, nurses should chart as soon as possible. They should use direct quotes whenever possible. Nurses should be objective in charting and write only what they see, hear, feel, and smell. Chart facts and avoid judgmental terms and placing blame on others. When a patient leaves the unit, make sure the nurse charts the time and method of transportation on departure and the time and method of transportation on return. The nurse should chart ordered care as given or explain any deviation from the ordered method of care. The nurse should note any patient response to treatment and the response to analgesics or other medications as well. Most facilities have a published list of generally accepted medical abbreviations and terms approved for charting. Please review some of these common, unaccepted medical abbreviations. There are two main methods of recording. The first is paper record, which tends to be episodic in origin. Key information in this type of documentation may be lost from one episode of care to the next. The second main type of healthcare recording is the electronic health record, or ER. This is a digital version of patient's medical record. The key advantage of an electronic health record for nursing includes providing a means to compare ongoing clinical data about a patient with the original baseline information and maintaining ongoing record of a patient's health education. This kind of record improves the patient's continuity of care. Nurses may document in these two types of records in many different ways. The first is narrative reporting. This is a traditional method which uses story-like format to describe patient events. This may include repetition and is very lengthy and sometimes disorganized. Another way to report patient information is problem-oriented medical record, or POMR. The PMOR is a method of documentation that is organized according to the patient's healthcare problems. Data is organized by problems and diagnoses. The PMOR includes information on the database of general patient information, the patient's problem list, nursing and other healthcare professionals' care plan, and the patient's progress notes. There are many different methods a nurse can report based on the nursing process. Examples of nursing process charting include SOAP, SOAPy, PHI, and DAR. SOAP charting includes reporting subjective information, objective data, nursing assessment, and plan of action. SOAPy also adds nursing interventions and evaluations. PHI charting is problem, intervention, and evaluation. Focus charting, or DAR, is data, action, and response. All of these methods are based on the nursing process. Methods of reporting patient information can be found as source records. Source records are separated into nursing, medicine, social work, and respiratory therapy divisions. The advantage of having information spread through the chart in different divisions is that caregivers can locate each section in which documents are entered. The disadvantage is that patients' problems are distributed across the healthcare record in different areas under each division. Charting by exception is focused on documentation, how the patient deviates from the norm, and is discussed on the next slide. Case management plan and critical pathways include interdisciplinary care plans that the patient's problems, key interventions, and expected outcomes are established and identified within a specific time frame. Expected outcomes that are unmet and interventions not specified within the critical pathway are called variances. Charting by exception is a format used by several facilities in which a beginning shift assessment is documented and only additional treatments, changes in the patient's condition, and other pertinent data are recorded at different time intervals. The benefit of this type of documentation reduces the amount of time the nurse needs to chart and also limits the healthcare's liability for variances in nursing documentation. The nurse completes a nursing history form when a patient is admitted to a nursing unit. This guides the nurse through a complete assessment to identifying relevant nursing diagnoses and problems. The flow sheet is a graphic or pictorial representation that helps team members quickly see patient trends over time and decreases time spent on writing narrative notes. Flow sheets are usually used with coding systems for data entry. Many hospitals now have computerized systems that provide information in the form of patient care summary that is often printed for each shift and updated as needed. The summary automatically updates nursing notes and helps make decisions regarding patient care. In some settings, a cardex is kept at the nurse's station and is updated for charge nurses and eliminates the need for repeated referral to the chart for routine information throughout the day. After completing a nursing assessment, the nurse identifies standard care plans that are appropriate for the patient and places plans in the patient's medical record. Discharge documentation includes medication, diet, community resources, follow-up care, and to whom the patient must contact in an emergency or for questions. Acuity records are not part of the patient's medical record. They are used for determining the hours of care and the staff required for a given group of patients and helps justify nurse-patient ratios. Standardizing communication during handoff reports helps ensure patient safety. Handoff communication include up-to-date information about the patient's condition, required care, treatment, medication services, and any recent or anticipated changes. Many medical errors have occurred while receiving telephone reports. To help minimize these errors, hospitals use standardized communication tools like the SBAR, which stands for Situation, Background, Assessment, and Recommendation. Nurses are also required to read back information received or orders received via the telephone. When communicating over the phone, nurses should determine the patient's name, room number, and diagnosis. They should repeat any prescribed orders back to the physician or healthcare provider. Nurses should clarify questions to avoid misunderstandings and write telephone order or verbal order, including the date, time, and complete order, and sign the name of the physician or healthcare provider and the name of the nurse taking the order. The nurse should follow agency policies for the institution that require telephone and verbal orders. Most telephone or verbal orders must be co-signed or signed by the physician within 24 hours. The nurse should be sure to document every phone call that's received a telephone order and be able to read back the order. Nurses should also be able to follow agency policy when reporting incidents or occurrence reports. Incident reports are used when a patient's care was not consistent with the facility or national standards of expected care. The nurse should give only the objective or observed information. The nurse should not omit liability or give unnecessary details. The nurse should not mention the incident report in nursing notes. Examples of incident reports include reports provided for patient falls, needle stick injuries, any medication administration errors, accidental omission of orders or therapies, or circumstances that lead to injury or risk of injury for the patient.